Next diagnostic modality we're looking at for any heart disease is what? Aortography. And aortography, this is it. Okay, it's an imaging modality for this heart, any heart conditions. Okay, so you're trying to what? Look at the aorta. Okay, so we're talking about this aortography from the definition. We look at the types, look at the indications. That's when you should do an aortography. Then we look at the procedure, like how is an aortography done. Then we look at the risks and complications of what? Aortography. Okay, so you are viewing the aorta. First of all, I said heart disease, but aortography is just simply to check about anything that is wrong with the aorta. Okay, you want to look at the aorta. So aortography is actually a medical imaging test used to what? Visualize the aorta and its branches. It involves injecting a contrast agent into the aorta through a catheter, followed by what? So now when you inject the contrast here, when you do an x-ray, it will now bring a clearer picture of the aorta. But without the contrast, the aorta will not be visible enough. Okay. So talking about the types of aortography, there's a conventional aortography. This one uses a catheter through an artery in the leg or arm. There's CT aortography. This one combines the CT scans with contrast agent injection. Then we have the MR aortography. This one uses what? MRI technology with contrast agent injection. Then indications when you should do an aortography. That's when there's a suspected aortic dissection or aneurysm. Aortic dissection, right? Let me define it. It's like, you know, the artery has what? An inner layer, middle layer, and outer layer. So in aortic dissection, there's a separation from the inner layer is being separated from the middle layer. So now blood is flowing inside and also between the inner layer and middle layer. So you want to do an aortography for that. There's aortic aneurysm, you do it. There's aortic stenosis or insufficiency, you do it. There's peripheral artery disease, you do it. Traumatic aortic injury, you do it. Congenital aortic abnormalities, you still want to do it. Okay, procedures now. How is it done? The catheter is inserted through an artery in the leg or arm. Then after you insert it, then you inject the contrast agent. Okay. Then after you inject the contrast agent, then you do x-rays or CT scans or MRI scans. Then after you're done with everything, now you now remove the catheter. Alright. There are risks and complications now because you are invading the person, right? And you are invading a major blood vessel. So it could lead to bleeding or hematoma at the catheter site. Could lead to allergic reactions to the contrast agent, lead to kidney damage from the contrast agent, could lead to infections, could lead to artery damage or blockage of the artery. So benefits of this aortography now, basically you are getting to view the aorta better. So if there's any disease condition, you can accurately diagnose it. So you can accurately diagnose what? Aortic conditions. Then it is also a guidance for endovascular procedures. Also, you can use it for monitoring aortic disease progression. You can use it for planning for surgical interventions for patients. Okay, so that's it for aortography. Definition, types, indications. That's uses, right? Procedures, risks, and complications.